The adolescent has felt so much suffocated. They have glued so much to screen, so much to the virtual world. Again, that's why the depression and anxiety has gone up in this lockdown. The parenting styles, if there's harsh parenting styles, if parents are like authoritative, if there's family conflict, if there's abuse in the family, all this increases the chances of depression in a teenager and adolescents. Simultaneously, increased access to social media and internet, which has happened in the lockdown. And the important than the increased access to social media and internet, what is FOMO, fear of missing out, feeling of inadequacy. Kuch miss to nahi ho gaya, something I've missed. This fear of missing out. I have so many teenagers who have come to me because of FOMO. That is important. Now, adolescence is also a time when they're exploring their sexuality, gender issues, relationship issues. And if there's conflict, a lot of times, sometimes the adolescents feel that we are bisexual, we are asexual, we are transsexual. And then they feel that nobody understands us. People don't understand our gender issues. And that again leads to depression. Peer pressure, academic stress, body image issues, very, very common, body image issues. High sensitivity to social cues and high sensitivity to social rejection. All these psychosocial factors makes an adolescent prone for adolescent depression. That is why we need to identify these risk factors. Once we are able to identify these risk factors, we can intervene. So, though adolescence is a vulnerable, it's a very wonderful time. It's such a time when we tend to explore the world, but simultaneously, it also increases the vulnerability for depression in this precious age group. Now, what are the symptoms of depression? So up till now, we have talked about the figures, the prevalence of depression. We have also talked about that why adolescence is prone for depression. We have also talked about various risk factors. Now let's come to the symptoms of depression. To make things simple, I divided into 3. The first three symptoms are low mood. They're feeling low. But a lot of times, the teenagers present with irritability. Chirchirapan. Choti choti baaton mein they get irritable. That doesn't mean that all adolescents who get irritable have depression. No. But along with that, irritability is persistent. It's continuous. That is important thing. Along with irritability, they also have anhedonia. This is very important. They lose interest in the pleasurable activities. The things which they were enjoying, the dance, the music, interacting with the friends, drawing, painting, cooking, all they stop enjoying. Anhedonia. They get tired easily, easy fatigability. So these three are the cardinal symptoms of depression: low mood or irritability, anhedonia or decreased interest, and easy fatigability or getting tired easily. Along with that, hopelessness. There's no hope. Helplessness. Nobody can help me. Worthlessness. I don't have anything to contribute. I'm not capable of doing anything. These three are the cardinal symptoms. If any teenager says that there's no one to help me, I'm not capable, I'm not worth, what is the point of living? Please explore for depression. It may be just a cry for help. आप बहुत बार teenagers को देखोगे वो इस तरह बोलते हुए. But remember, its underlying must be depression. They're unhappy. Loneliness. And this loneliness is something which creeps them. Recently, Japan, one of the important countries, have just now appointed a loneliness minister. And in the world, there are only two countries. One is UK and one is Japan, who have a loneliness minister to address the issues of depression and suicide and loneliness as they're increasing, and especially have increased during the COVID time. Along with that, the other three changes are sleep changes. They can have decreased sleep or increased sleep. Appetite changes, decreased appetite or increased appetite. Changes in sexual drive. It can either increase or decrease. And another important factor is death wishes. They don't want to live. They don't want to live. They feel there's no point to live. Death wishes. Suicidal ideation and plan. Suicidal ideation and planning. They feel like that, it's better to commit suicide. It's better to die off. And they keep on thinking about suicidal. ideations. They keep on planning, and sometimes they attempt also, and they become complete suicide. So these 12 are the most important cardinal symptoms of depression. Low mood, anhedonia, easy fatigability, hopelessness, helplessness, worthlessness, sleep changes, appetite changes, change in sexual drive, death wishes, suicidal ideation, and attempted or complete suicide. So the symptom should be present. Now, it does not mean that everybody who says, I'm feeling low, nahi mera man kharab hai, main udaas hu, that is not depression. When we talk about depression, we talk about as a syndrome. Not everyone who is depressed experiences every symptom. Just remember one thing. Some experience only a few symptoms and some of many. And the severity and frequency of symptoms and how long they last will vary from adolescence to adolescence. So in early adolescence, like age group of 10 to 14 or 10 to 15, mostly irritability. They can have unexplained physical symptoms like headache, stomach ache. Again, this is very common. Headache ho raha hai, stomach ache ho raha hai, but no medical reason. You go to doctors, no relief, and it keeps on going on. So if any teenager in your school keep on complaining of headaches and stomach aches and have been to multiple doctors and no relief, look for adolescent depression. Poor school performance. A child who was doing very well was getting 90% or 80% and suddenly goes down to 40%, 30%, look for depression. Short attention span. A child who was doing very well till the age of class 7th, and suddenly his attention span, he get distracted very easily. He get lost, daydreaming, look for depression. A child who used to love his school and start saying, I don't want to go to school, I hate my school, school refusal, look for depression. Peer problems, bullying, sleep appetite changes, defiant behavior, and excessive use of internet and addiction, always keep a watch for depression. That does not mean that he may or she may be having depression, but yes, if you're able to identify easily, if you're able to intervene easily, you will see that yes, the child will get right intervention at the right time. That's important. Correct? Now you see about the late adolescence and young adulthood. Correct? Now, in late adolescence, young adulthood, what happens? So late adolescence and young adulthood, cognitive symptoms begin to emerge. This is the time when 14 to 15 years of age, hopelessness, helplessness, death wishes, suicidal ideation starts coming up. Sometimes even 10-year-old can also have a suicidal ideation, but that is quite rare. 8-year-old, 10-year-old. 8-year-old, 10-year-old presenting with suicidal ideation, death wishes is very rare. But mostly they start by the age of 13, 14 years onwards. They start having anhedonia, negative thoughts about self, others in the world, non-suicidal self-injury, cutting, slashing the wrist. This is usually you see a phenomenon in 9th class, 10th class, 11th class students. Attempted suicide, substance abuse, and most common is a weed use, cannabis. That is what. And why, when I ask a lot of teenagers who comes to me, why do you cut yourself? Why do you take weed? You know what do they say? They say because we have so much of emotional pressure, not academic pressure, emotional pressure. Itna jada disturbance ho jati, we want our emotions to release. That's why we need to cut. We need to take weed because it becomes so much emotionally overloaded for us. That's why they take it. So, important thing is that we need to teach our adolescents and teenagers about their emotions, about regulation, about emotions, about to manage their emotions. If we will be able to do that, then I'm sure we will prevent a lot of teenagers to go into depression. So these are the symptom profile of depression across early adolescence and late adolescence. The important thing is that in early adolescence, more of physical symptoms, unexplained and irritability. In late adolescence, more of negative thoughts about self and self-injuries and substance abuse and negative thoughts about self. This is the major difference. Now you will think, how do we decide the severity of depression? Mild, moderate, severe. If number and type of symptoms are 4 or less than 4, if there's no suicidal ideation or no psychosis, and if they're able to function in most ways but takes more effort, then it is mild depression. When it becomes moderate depression, when there are 5 to 6 symptoms, suicidal ideations are there, an impairment in at least one domain, either at home or school. If the symptoms are 7 or more than 7, imminent suicidal risk. They could have psychosis also, and they're unable to function adequately with impaired self-care, then it is severe depression. Mild depression is very, very common in population, which is not detected. Moderate to severe becomes more visible. But even mild depression can lead to poor school performance, school dropout, and school refusal. So we as school teachers, counselors, and coordinators have to be careful to identify depression, even the mild depression. Now, this is very, very important slide. We need to identify, a lot of people ask me, why is adolescent depression different from adult depression? Yes. The thing is that the adolescent depression, the irritability is more, as I told you. They can be sad also. They can be depressed, but irritability becomes more prominent. Agitation becomes more prominent. In adolescent depression, there's a delayed sleep phase. That means they will sleep by 2 o'clock, 3 o'clock, 4 o'clock, which is very, very common in adolescents, teenagers. And they will sleep by 3 o'clock, 4 o'clock, and also they'll have sleep difficulties. A lot of increased appetite and weight gain. That's why we see a lot of adolescent depression with obesity and body image disturbances. And also, they will have impulsive behavior, especially in the girls, self-harming, binge eating. And in boys, more of substance abuse and risk-taking behaviors and aggression. So this is the profile of difference between adolescent depression versus adult depression. Sometimes, a lot of people ask me, a lot of parents come and says, sir, you are saying my child has a depression, but he's smiling. He's happy with his friends. But as soon as he comes home, he becomes so irritable, so agitated. He says, I don't like you, I hate you. I don't want to do anything, I don't want to study. But the thing is that he may look to be happy, but he is not happy. That is the thing is that. So we as counselors and school coordinators have to identify that population. He may be having just a mild depression. And what can we do? We'll talk it out. Another point which I want to emphasize is suicidal behaviors. Suicidal behaviors are thoughts or actions that may lead to self-inflicted death or serious injury. It's almost like a spectrum. On one hand is non-suicidal self-injury, which is usually done in teenagers to release their emotions, emotional release, their anger. Something is just locked inside. They want to release it. They want it to they just want it to be, to just get a channel. Correct? That's what. And that is why they just keep on slashing their wrist. Non-suicidal self-injury. They don't want to commit suicide. They don't want to attempt suicide. They just want to release their emotions. That is why it is called non-suicidal self-injury. And whenever you see somebody like this, remember, it is a cry for help. Remember, that person, that adolescent is having an emotional chaos. It is not attention seeking. बहुत लोगों को लगता है it is an attention seeking. No, it is a cry for help that I am feeling hurt, I'm emotionally disturbed, I'm perturbed. Please help me, ma'am. Please help me. If you can bring me out of the chaos. A lot of times they don't share. They don't share about their bullying. They don't share about their body shaming. They don't share about their cyberbullying, but they're suffering. They're the silent sufferers. And that is why we need to identify them. Another important thing, then from NSSI, it becomes non-fatal suicidal behavior, which is suicidal ideation, to plan, or suicide attempt. Now, in non-fatal, they will do only ideas will be there, they will plan and they will attempt. But unfortunately, sometimes it becomes a fatal or complete suicide. Let's see this slide. So they're experimenting with non-suicidal self-injury. They're cutting, slashing. Sometimes once or twice, sometimes repetitive, but gradually it turns out to be a suicide attempt. And with suicide attempt, Unfortunately, sometimes it becomes a complete suicide. So this is the whole course, the whole spectrum, if you see, of a suicidal behavior. Now, in non-suicidal self-injury, as I told you, there's no intent to die. They use multiple methods, high frequency, low lethality, and they feel relieved on completion. They feel after they slash the wrist, they feel so relaxed, as if they've calmed down. But in suicide attempt, there's intent to die, high lethality. It elicits care, compassion, and concern. But non-suicidal self-injury, it elicits disgust, fear, and hostility. That's the difference between two of them. So NSSI is mostly like a cry for help, and suicide attempt is like more with hopelessness. Whenever the hopelessness comes into it, remember means it's almost to a moderate to severe depression. That means the person is almost about to make a suicidal attempt. So single predictor of suicidal behavior is hopelessness. अगर एक बार hopelessness आ जाए, then it becomes so difficult to bring out of it. It is very challenging. Now, what are the red flag signs? Either school counselors, school coordinators, what are the red flag signs of depression? When should we be alert in an adolescent? Adolescents who have been doing very well or doing well, and gradually or suddenly they become withdrawn, weepy or unsociable, think of depression. If they become aggressive or involved in disruptive behavior, think of aggression. A lot of time you find teenagers in your school, they were doing very well. Suddenly they are becoming so abusive, so aggressive, and disruptive. It could be underlying depression. They can't express. And when they can't express, they tend to go into disruptive behavior. Look for depression. Difficulty in concentration, memory. Again, red flag signs of depression. Altered sleep and appetite, always look for depression. Persistent unexplained medical symptoms, another red flag signs. Recent decline in school performance, again red flag signs. Expressing hopelessness, suicidal ideation, or threats, again look for depression. This is one of the most severe red flag signs, urgent red flag signs. कोई भी बच्चा अगर होपलेस हो रहा है, बोलता है कि मैम कुछ नहीं हो सकता मेरा, मैम nobody is there to help me, ma'am, it's such an I feel like sometimes I should end myself. Please be careful. That's the most severe emergency situation. Immediately you have to act. And if anybody makes a suicidal attempt, don't think it's an attention seeking, it's another red flag sign. So becoming withdrawn, weepy, unsociable, becoming aggressive or involved in disruptive behaviors, difficulty in concentration, memory, altered sleep appetite, persistent unexplained medical symptom, recent decline in school performance, expressing hopelessness, suicidal ideation, threats, and suicidal attempts. All these are the red flag signs. All these 8 red flag signs of depression. But simultaneously remember, at least 2 weeks of depressed mood or losing interest in pleasurable activity or irritability. And along with that, there's a functional impairment in social, occupational, educational setting, at home, at school, or in academics. Clear? So whenever we see any red flag signs, we also have to look that there is an impairment in the academics or at home or at school. Simultaneously, the adolescent also have at least 2 weeks of depressed mood or losing interest. And it is going for at least 2 weeks. That means, yes, it is going on for quite some time. Clear? Now, why the important question comes? Why is early recognition important? हमें depression को identify जल्दी क्यों करना है? As I told you, 40 to 50% of mental health condition starts by the age of 14 to 15 years of age. So that's why if we are able to identify early, then what happens? There's improved diagnosis and less intense treatment. Jitna jaldi utna behtar. The earlier you intervene, the better it is. That is why. Also, early identification intervention, it restores the functionality in terms of relationship, social participation, education, attainment, and employment. Otherwise, depression becomes I have so many teenagers because of depression, because of school refusal. They are not going to school. Their academics have gone down. They have drop out from education, they don't want to study. That is why their relationships are having difficult time. That is important. So we need to restore functionality. Also, it changes the life trajectory if we are able to identify early, and we can save life. Anybody to go to become a suicide attempt or complete suicide. Timely and targeted referral to specialist services. It reduces the treatment cost. As per WHO, by 2030, once the depression will become number one, we will be losing $1.6 trillion because of depression, which is a big number. That means mental health will take a big toll on the society. Mental health will take a big toll on the productivity, educational attainment, employment, relationships, hospital load, mental health load, professional load. That is why we need to identify early and intervene early. And fewer and lesser severe continuing symptoms, the longer and fuller recovery. जितना जल्दी हमने उनको पहचान लिया, उतना जल्दी रिकवरी होने के चांसेस ज्यादा हैं. The more it becomes chronic depression, then it's a difficulty to recover. Then, and the early we intervene, there's reduced chances of relapse. That is why it is important to identify early and intervene. A lot of people ask me, how can we protect ourselves from depression? Yes, we can protect ourselves from depression. There are a lot of protective factors. And this is what we need to promote. High level of family functioning. The family who eats together, the family who prays together, the family who plays together, the family who enjoys together. That is important of family bonding. So higher level of family functioning, the family knitting, family bonding, family network. In today's world, with a lot of chaos happening in families breaking down, a lot of marital conflict, domestic violence. So definitely this protective factor has become a question mark in today's world. Academic and school competency. If you're having a good academic record, good school record, again, it's a protective factor from depression because it keeps you up. It boosts you. Another important protective factor is positive youth development, high self-esteem, emotional competency, social problem solving skills. And that is what, as school counselors and school coordinators, we need to work on this positive youth development. How can we enhance their self-esteem? How can we enhance their emotional competency, emotional regulation? How can we enhance their problem solving skills? That is important. अगर हम ये सब कुछ एनहांस कर सके अपने स्कूल के अंदर, अपने एडोलेसेंट्स टीनेजर्स में, तो हमारे बहुत सारे टीनेजर्स हैं जो डिप्रेशन जाने से बच सकेंगे. We can really be able to prevent depression. Hobbies and interest, very, very important. Painting, drawing, dancing, theater, cooking, baking, gardening, sports. It really channelizes energies. It releases good chemicals, endorphins, and you are protected from depression. Peer support, very, very important in this age group. A good peer support is like a very strong protected wall around you, like a great wall of China. It protects you. एक कवच है आपके लिए. It's an armor, a good peer support. And a lot of children who comes to me, they comes to me because of peer rejection, lack of acceptance by the peer group, peer bullying, peer like body shaming, cyber bullying, all because of peer issues. Because in this age group, the peer acceptance and peer support is very, very important. So ये सारे protective factors हैं. High level of family functioning, academic and school competency, positive youth development, hobbies and interest, and peer support. अब हमें देखना है हमें करना क्या है. What can we do as a school counselor जहां पे हमें पता चले कि किसी बच्चे को डिप्रेशन हो रहा है या है. So as a school counselor and coordinator, हमने red flag signs, we have talked about red flag signs, we have talked about the protective factor. So as soon as we see those red flag signs, identify those high risk cases and refer them to mental health professionals. But before that, talk to the adolescent individually. Empathetic listening. बात करना जरूरी है. A good teacher, a good coordinator, a good counselor can really save a life, can really guide a life. That is important. और कभी भी वो स्टूडेंट उस कोऑर्डिनेटर काउंसलर को जिंदगी भर नहीं भूलेगा, because that empathetic listening, that half an hour, 1 hour of listening would have changed his life, because he was at a crisis. So what can you do in brief problem solving in that acute situation? Deal with the crisis here and now. Deal with the crisis here and now. How do you? You suggest them alternative self-soothing methods like exercise, music, hobby. You list those problems. Beta batao, tell me what is going on, what is bothering you. List those problems and do brainstorming with them for the possible solutions. Environmental manipulation, just discussing those solutions, emotional catharsis, all that can help in that brief crisis, in that crisis by in that acute situation, and by getting those brief problem solving. Important thing is that it should make a sense for the adolescent. That is important. That is the empathy. Wearing the shoes of the adolescent, understanding the issues of the adolescent. उसकी प्रॉब्लम उसके नजरिए से समझना, understanding the problem from the perspective of the adolescent. And if it makes sense for the adolescent, he says, yes, ma'am, you're right. I got it. Thank you, ma'am. Thank you very much. Now I know I can come out of it. Now I know I can get out of it. And once you do that, it will create a sense of safety and hope. That is important. So making a sense for the adolescent, creating a sense of safety and the hope, dealing with the crisis, suggesting alternative self-soothing methods, and listing problems and possible solutions. That's all. This is a very important part which you can do as a school counselor and school coordinators in that time. Then identify those support persons. It could be a peer group, it could be a friend, it could be a teacher, it could be parents, and that alliance that can be trusted. Because they feel that there's no one to trust. They feel that their trust has been broken. So if a teenager is able to understand that there's someone whom they can trust, they will be relaxed. Along with that parental education, you need to involve the parents and ask the parents to remain calm. Do not punish. Do not push them to talk. Bata beta, kya hua? What happened? What happened? No. He's not comfortable in talking to the teen parents. He wants his own space. And parents sometimes crosses the boundaries. That is important. So we need to give time. I have so many teenagers who doesn't want to talk to their parents because they feel that they become so intrusive. They cross the boundaries. They don't understand them. They say to the parents, please go out. They close the door. They bang the door. They don't want to talk. That's why we need to tell to the parent, do not push them to talk. And simultaneously, we have to tell the parents, focus on the underlying struggles, encourage the positive coping, allow them the time to learn alternative methods. This all can be done by the counselors and the school coordinators in this schedule. But important thing is that family, school, and mental health professional collaboration is a critical component. You as a school counselor and coordinator may be doing so much, but along with that, you need to have a collaboration. The family, school, and mental health professional collaboration is a critical component of intervention for students with depression. Now, this is a very important triangle which I want you to understand. You see, in the first is a screening, second is awareness workshop, then preventive model, then counseling and refer to specialist. But important is that we have a scarcity of mental health professional. We don't have, for the whole school, there's 1 or 2 counselors. और बहुत सारे स्कूलों में तो काउंसलर्स भी नहीं है, और कई स्कूलों में with student strength of so much, there may be only 1 or 2 counselors. So it is so difficult for the counselors to address the whole school. Sometimes they have to be involved in substitution also. They have so many other loads also. They have to prepare so many other things also. So in this model, important thing is that involving the mental health professional. So counselors may not do everything, cannot do everything. Teachers and counselors, coordinators. So they have to do a tie-ups with mental health professionals. And by doing this, by involving mental health professional, a lot of time what happens, your burden on you also will decrease, and simultaneously the listening of students and the parents will also change. But this is the pyramid. By creating awareness workshops, by screening them, you're able to follow a preventive model. 1, 2, 3. And in 1, 2, 3 is something which you can do in the school. For selected population, you can do counseling. That also can be done in school, if time permits you. And then if required, refer to a specialist. But for these 1, 2, 3, 4, it may be a load on you as a 1 or 2 counselors in the whole school. That's why collaboration and tie-ups with mental health professionals, with mental health organizations is very, very important. This slide will explain you more. Tier 1, Tier 2, Tier 3. Tier 1, universal intervention. That means providing intervention to everyone, correct, in a given population, to students, to parents, to teachers. And simultaneously, social emotional learning, staff education about depression, teaching all parents about signs of depression, be vigilant about bullying in school. And then Tier 2 is targeted. Tier 1 can be done in school. Even Tier 2 also can be done in school, provided to individuals or groups of people at risk for developing depression. Groups for children of separated, divorced parents facing loss of parents, caregivers, and abuse at homes. So these are the population of children who are at risk. Intervention for students facing bullying and discrimination. Support group for special needs children like ADHD learning difficulties. All this can be provided at home, at school, sorry. So Tier 1 and Tier 2 can be done in school, along with collaboration from the mental health professional organization, so that the burden does not, so there's not much burden on you, and simultaneously you get adequate support from mental health professionals. Because 1 or 2 counselors can't address everyone. And if required, the Tier 3 intervention, where you refer, provided to students who have symptoms of depression, who are at very risk of developing depression, including a variety of individual and group counseling program for students with symptoms of depression. There you refer them to specifically to mental health professionals, psychiatrists and psychologists who provide them exact intervention for their depression. Now let's see. This is very, very important. Again, this is a part of Tier 1 and Tier 2, mostly of Tier 1. Now, you see, we need to have knowledge how to seek mental health information. And this is all goes into mental health literacy. Every step counts. So school has to join hands with mental health organizations and professionals. Why? So that we are able to provide you knowledge how to seek mental health information. Attitude that facilitates recognition, help seeking. Knowledge and belief about professional help. And knowledge and belief about self-help. And when it comes from the mental health professionals, and as the awareness is increasing across the country, across the metros, parents and teachers are open to learn about mental health issues. That is where the collaboration comes, to give that knowledge, to impart that knowledge and belief. And there we can help you. And that's where we came out with this program called Emo Aid, Emotional First Aid, which I was talking about. A program, an online program to address your emotions, just as you would need for a physical well-being. जैसे physical first aid होता है, उसी तरह emotional first aid. The way you need to address your physical well-being, same way you need to address your emotional well-being. It's a scientific program in a group setting. It's an online program, group setting, with 20 simple and effective techniques, which is effective both for children and adults. It helps to build positive feelings and a better coping mechanism. What does Emo Aid provides? Emo Aid provides insights into own mental health, your own emotions. It organizes and declutters your mind. It helps you to manage your interpersonal relationships. It helps you to deal with everyday stress, to remain calm, and the most important thing is to be happy. Happy, that is important. Happy teenager is a productive teenager. Happy teenager can do wonders. That's what every teacher wants. That's what every school wants. And these are the various components of Emo Aid. Learn to measure your own well-being, regulate your emotions with language, physical techniques, mind techniques for thoughts and emotions, and emotional healing techniques. And we have been doing this program since last 9 months with a lot of success. We have covered more than 800 students and adults across the country with promising results in online program. So it is something which can help people to to learn about their own emotions and to deal with them emotions at the first level. At the first level. और अगर ये हमने स्कूल के लेवल में भी सिखा दिया टीनेजर्स को, if we are able to teach them, then a lot of times they may not go into a level of depression. They will have disturbances. The moment they have disturbances, they will be able to use emo aid. If they have difficulties, they will be able to use emo aid. Like a band-aid. If you have band-aid, you are able to apply that so that the bleeding does not happen. So, and if that emo aid is given, mental health awareness is given along with emo aid is given, then what will happen? Your load will go down. You will be able to prevent depression. And few people who get depressed really are still get, then they are able to get mental health expert helps. That is the beauty of emo aid. So when to refer to a specialist? If there's persistent low mood, more than 2 weeks, drastic changes in behavior, severely withdrawn, isolated, frequent mood swings, aggressive behavior, expressing wish to die, recurrent self-harm, suicidal ideations or attempts, risk-taking behaviors, excessive substance abuse, prolonged school refusal, extreme difficulty in concentration, drastic changes in sleep pattern, and significant change in weight over a short period of time in absence of any organic cause. That means आपको psychiatrist के पास या psychologist के पास refer करना ही करना है. You need to refer to a specialist because these are the urgent indicators when you should refer them to a specialist. Clear? That means you need to provide. This means they may be having almost moderate to severe depression. What are the guidelines? The guidelines are, if it is mild depression, that is after you've screened them for depression, MDE means major depressive episode. After you've screened them for major depressive episode and subsequent diagnosis, you have to educate the family. You have to plan the treatment. How do you plan? If it is mild depression, 4 or less than 4 symptoms, active support and monitoring for 6 to 8 weeks. If it is moderate to severe depression, like more than 4 symptoms, 5 to 7 or more than 7, suicidal ideation, then begin evidence-based therapy or medication, at least for 6 to 8 weeks. If it is severe depression, then you start the medication first. Very clear? So mild depression, no medication. Moderate to severe depression, medication may be required along with therapy. And severe depression, you start the medication first. These are the various guidelines, and we follow these guidelines. So whenever somebody is referred to us, to a mental health experts, to me and my team at CCW, correct, and at Gangaram Hospital, so what we do, we interview the parents and adolescents. And after that, when we interview the parents, what do we find? That parents are better at reporting the behavioral disturbances, that he's irritable or she's irritable, doesn't sleep, aggressive, abusive, doesn't study. And adolescents is better in reporting the mood and anxiety and sleep, that my mood is low, I don't feel happy, I get anxiety, I get panic attacks, I get flashbacks, I don't get sleep, nobody understands me, I feel hopeless. That's what. And if required, you can even do a depression inventory, like children depression, you're like Beck's depression inventory. So there's multiple questionnaires are there. And also if required, we do the blood test, because a lot of time they have deficiencies, which is also related to depression. So interviewing, inventories, and blood test. After that, as I told you, we educate the parents. We also work with the school if they're open to work. We educate the teenager also. There are various therapies are there, supportive therapies, cognitive behavior therapy, CBT, which works on the cognitions, dysfunctional thought process, interpersonal psychotherapy, which works on the interpersonal relationships, EMDR, eye movement desensitization reprocessing, EMDR. Our team is trained into it. When there trauma incidents are there, trauma is there. Some abuse has happened, sexual abuse happened, some bullying happened, cyberbullying happened, traumatic incidents happened. If they witness them, all this can be worked out with EMDR therapy. Then family therapy, very important. If there's malfunction or dysfunctional family is there, we need to work on the family dynamics. Family work has to be done. That's what. And if it is moderate to severe or severe depression, then we have to use antidepressants. Correct? So antidepressants are used for severe depression, suicidal behaviors, and not responding to psychological intervention. And once we start the medication, at least 6 to 12 months. These are the guidelines. So a lot of times, teenagers will come and ask you, Ma'am, and they will ask you. So please encourage them that they should continue medication for at least 6 months. That's very, very important. A lot of time they start the medication and then they stop the medication when they start feeling a little bit better. Just now I saw a child. He was feeling better. Then he stopped the medication in the month of September. And again, he contacted me after 5 months. Again, his depression has gone up. He's in class 12th. Board exams are coming up. Yes. So he immediately contacted me. He's not able to sleep. He's having headaches. He's getting negative thoughts. He can't focus. Yes. So I've asked them to modify the medication along with therapies. So important is that the duration of medication. Why 6 to 12 months? Because the first 6 months are very important after depression. That is the time you can have a relapse. That is the time your depression can come back again. That's why you need to at least have medication for 6 to 12 months. In 2017, we did a very wonderful study. Me and my colleague, Dr. Jalnidhi, at Gangaram Hospital, we did a study. And we studied 70 adolescents. And we found out, we wanted to study that once they have an episode of depression, what is that prevent them to have a second episode of depression? So the study aimed to assess the prognostic factor for recovery from depression among the group of adolescents who recovered after the first episode of major depression compared to those who had relapsed. हमें ये जानना चाहते थे कि वो कौन से बच्चे हैं जो रिलैप्स कर जाते हैं और कौन से बच्चे हैं जो रिलैप्स नहीं करते. और हमें क्या पता चला? Surprisingly, what we came to know was the good parent-adolescent relationship, the family thing, which I was talking about. If work on emotional and behavioral self-regulatory skills, EMOAID, I was talking about the EMOAID. When you work on the emotions, resilience building, good academic performance, good in extracurricular, high intelligence, and compliance with treatment. All these were predictors of positive outcome that they don't go into a second episode. Correct? ये सारे जो हैं, death wishes, suicidal ideas, suicidal attempt, non-suicidal self-harm, presence of family aggression, joint family, none of them were the predictors. So important thing is working on the relationships, working on the emotions, building resilience, and enhancing their academic performance, extracurricular activities, and high and compliance with the treatment. So in the end, it's been almost 8:24. Adolescence is a vulnerable period for depression and self-harm. There are numerous risk factors. What is important as school counselors and school coordinators to maintain a high degree of suspicion. It's more common than you think. Important is to maintain a neutral, non-confrontational approach. Let's look for prevention by using models of mental health awareness, by working in collaboration, by using models like EMOAID, and also early identification, referral, and timely appropriate intervention with an attitude of sensitivity and empathetic understanding. Thank you very much. Also, I want to emphasize the way we have done our work today webinar. We are also open to have mental well-being workshops, increase awareness workshops on mental health. So anybody who's interested to have these workshops to create mental well-being by understanding mental health, my team is ready to have this free workshop for 1.5 hours. It will help to recognize early signs of issues, creating openness to talk, identifying others who might need help, and comfort in reaching out, which can be for teachers, students, and parents. So anybody who's interested can email to us on this email ID, info@ccw.in. info@ccw.in. The contact number is there, 99533091188. This is the workshop for mental health. And anybody who is interested for having a workshop on EMOAID about emotions, again, it's a free workshop. What first aid tools do we have for our emotions? An outcome from the workshop will be become aware of your own emotions, to measure your own well-being, and experience the scientific techniques for self-care. To get a glimpse of instant tools for emotional regulation, you can email on Team EMOAID, teamemoaid@gmail.com, or message or WhatsApp on this number, 830-299-7891. We're always there to help you. And thank you very much for this patient listening. And this is my personal contact number, 98100461115. And this is my personal email ID, drdeepak@ccw.in. Thank you very much. We can take the questions, but please If you have any questions, please put them into chat box. We will try to answer all your questions in next 15 minutes. Thank you very much. And thank you very much for your patient listening. Patient listening. God bless us all. Thank you very much. Yes, Iti, we can take the questions from the chat box if there are any questions.
Waiting for questions, sir. Right now we're getting feedback. So if there are any questions, we'll address that.
Yes.
So, sir, we have a question that we're talking about adolescence. So, what is the maximum age when we're talking about adolescence?
Less than 20 years.
Okay. And the second question is, how do we deal with resistance from seeking help?
That's a very, very important thing. Whenever you have a resistance, don't force the adolescent for a help. Important is to create a context for the help. उसको जितना फोर्स करोगे उतना वो आपसे रेजिस्ट करेगा. The important is to create a context. And how do you create a context? By building a relationship. Correct? How do you build a relationship? By empathetic listening, by showing the concern, by not criticizing. So when you build an emotional relationship, I can understand. Yes, I can understand you're going through a tough time. Tell me what's going on. First, listen to his world. Enroll him. Once you enroll a teenager, the teenager will start loving you, liking you. And then say, yes, but I think there's a sir, there's a ma'am is there who can help you more. I want you to refer to him. I know him personally. They will help you. Please go. I will talk to your parents. Don't immediately refer them. No, go and meet a psychiatrist. No. First, because they should not feel rejected. They're very sensitive at that point of time. So important is that by building a relationship and enrolling them, and then gradually referring them to a right appropriate professionals.
Okay, thank you so much, sir. So we have a lot of questions coming up. I'll pick them up one by one. The next question is that if there's a child who is very aggressive and tends to blackmail sometimes, and sometimes he's very cool and cooperative, so what should we do in that case?
See, important is that we have to understand why he's becoming aggressive. Correct? Sometimes he's cool and cooperative, sometimes he's aggressive. So as a school counselor, Pallavi has written this question. So important is, Pallavi, that you need to understand why this youngster is getting aggressive. Every behavior speaks something. There's always something behind every behavior. So when you see somebody is getting aggressive, don't tell him that why you're aggressive, why you don't understand. No. Again, as I was talking about, call him in your room, understand his world. Better, what is there which is going on in your world? What is that which is bothering you? What is that troubling you? Tell me how ma'am can be helpful to you. He may be having bullying. He must be getting bullied. Must be something happening of cyberbullying. Somebody must body shaming. The child is suffocated, so he is becoming aggressive. That is where. So whenever any aggression happens, identify those children and try to talk it out with them. Empathetic listening. List out their problems. And once you list out their problems, then work out various solutions with them. Solution focused. And simultaneously, as we talked about emo aid. Bring emo aid in their life. Once they're able to get emo aid in their life, they're able to understand their emotions. Once they're able to understand their emotions, they're able to regulate them far better. That's the beauty of emo aid.
Thank you so much, sir. The next question is that if there's a denial from parents also in the acceptance of their child's problem, so how do we go about that?
Very good question again. And this is very, very common because parents, a lot of times, doesn't want. Correct? So important thing is that when parents are resistant, involve your authority like school principals and headmistress. And when the principal will say to the parent, please take help from so and so doctor, it is important for your child, then the parents will definitely go. If it comes from an authority, like senior coordinators or school principals or vice principal, then parents usually take right help. But important point, never blame parents. देखो आपकी वजह से बच्चा खराब हो गया ना, आपने ऐसे किया ना, never blame parents. If you will blame parents, parents will never take help. Instead, be an empathetic to them, understand their world, and then use your authority to refer them to right professionals.
Thank you, sir. The next question is that sometimes the child might be performing really well and then he suddenly becomes very erratic and drops in grades. So, how do we understand if it is depression or if it is something else?
As I mentioned to you, if there other symptoms of depression are there, poor school performance is one of the reason. Poor school performance could be because of physical causes also, because of chronic medical condition also, because of visual problems also, because of learning disability also. There could be multiple reasons. There could be a death in the family. Something could be there. But along with that, poor school performance, if the other symptoms are there, low mood, decreased interest, energy levels go down, hopelessness, helplessness, worthlessness, correct? Sleep issues, appetite issues, death wishes, then you think about depression.
Okay, thank you. And then there's another question coming up, that is there any relationship between antidepressants and young brain? So a lot of times there's side effects that people might see and because of which they might stop antidepressants. So if there's any long-term impact.
See, important is that any doctor who gives antidepressant gives for a reason. So what I will say, whenever somebody is put an antidepressant, there's a lot of myths are there. Ki antidepressant means the child will sleep. Antidepressant means the brain will get spoiled. No. Antidepressants are specific medications which works on serotonin and dopamine. And when they work on serotonin and dopamine levels, the depression improves. That's important thing is that. So antidepressants are always given in moderate to severe depression or whenever there's suicidal ideations and thoughts. It is not usually given for mild depression. So there's a rationale for antidepressant medication. It does not spoil. Sometimes you need to titrate the dose. Maybe initially when you start medication, maybe that medicine is slightly dose maybe more. So you need to be in regular touch with your psychiatrist. The psychiatrist will modulate the dose. Sometimes the way we take one painkiller, one antibiotic, it does not suit us. And when you go to the doctor, he changes the antibiotic and we start feeling better. Same way, antidepressants also need to be changed because there's no blood test. It's a clinical wisdom. Correct? So antidepressant does not spoil the brain. It helps you, but the important is the right medication and right dose and duration, at least 6 to 12 months.
Okay, thank you so much, sir. The next question is that sometimes when the person is depressed, they look for acceptance and approval outside. So is it normal and why do they do that?
Absolutely. One of the reason of depression is that non-acceptance, rejection. They feel rejected. They feel nobody is there to understand their emotions. They feel there's no one to care for them. And that is why they want approval and acceptance. They want validation. That is why important is to understand our own emotions. अगर हम अपने इमोशंस को समझ जाएंगे तो फिर हमारे को इनर एक्सेप्टेंस से काम चल जाएगा. When you need a lot of external validation, external approvals, then a lot of time when you don't get it, that is also the reason of getting depressed. And that is why a lot of people get depressed when they don't get appreciation, approval, and acceptance from outside. And that craving is one which really troubles them. So इसलिए important है, we need to love our own self. Love yourself and understand your emotions. And once you learn this technique of understanding your own emotions, you are able to regulate your own emotions, then you don't have that craving. Then you can be at peace. That's important.
Okay, thank you. I think we can take the last question and then we can wrap up. So the last question is that sometimes the symptoms of borderline personality disorder overlap with depressive symptoms as well, like rejection sensitivity. So how do we diagnose and create a distinction between both of them?
See, Josna, you have asked a very good question, but important thing is that they may be at risk for borderline personality. But in my experience of almost 25 years of experience, I've seen that when they were at risk for borderline at the age of 14, 15, 16 years, and you start working on them through medication, through therapies, through family work, I've seen them, most of them, they have not gone into a borderline personality disorder because they got the right help, they got the right family support. We were able to work on the family, we were able to work on their emotion regulation, we were able to change the narratives. And when we did that, we found that they become more productive and they're out of depression. और अब तो बहुतों की दवाइयां भी नहीं चल रही. They're out of, and they it's not correct. So borderline personality disorder looks like, I've seen a lot of times pseudo borderline personality disorder. So that's why I don't even write about borderline personality in the age of 15 to 19. I just work on them. And when I work on them, they come out of it beautifully. They do so well. They threat you. They give you a feel of it. But don't get into that sort of a fear. It's a borderline, you can't do anything. It's a borderline so overwhelming. No. Just continuously work with them consistently with the child and the family, with support from a psychiatrist, and they settle down and work on the coping skills and regulation of emotions. They come out beautifully.
All right. Thank you so much, sir. So I think we can wrap up the questions right now. And we have a lot of participants thanking you for the informative session. They really felt that this was the need of the hour because a lot of depressive symptoms have increased post-COVID-19. So thanking all of you for your participation and thanking you, Dr. Deepak, for such an informative session.
Absolutely, absolutely. And please do take advantage of this free workshops for mental health and also for emo aid. I'm telling you, this is this is a very, very unique opportunity which you're getting for your school. Please do take advantage. Our team is always here to work with you and to help you so that we can really collaborate with you and work with you. Thank you very much. Thanks for your time and God bless us all. Thank you very much.